Welcome back to Lens on Africa. Today we'll be having a conversation about malaria in Africa. Now, joining us to discuss malaria in Africa is a medical doctor with a master's degree in public health from the University of Washington, with over 25 years of experience working in public health. He is the Malaria Resident Advisor, U.S. Agency for International Development, Nigeria. Dr. Jules Mihigo, welcome to Lens in Africa, sir. It's a pleasure to have you.
Yeah.
All right, moving on. Also joining us is a fellow of the West African Postgraduate College of Pharmacists, Deputy Director of Pharmacists, Gesa Adonis Aka. Welcome to Lens on Africa. It's a pleasure. So, gentlemen, I'm going to ask the question, what is the state of malaria in Africa today? Doctor, I'll start with you, and then we'll go to the pharmacists.
Yes, malaria continues to be the major cause of death and disease in Africa. You can imagine in Africa we have more than 600 cases. Actually, the summary of the video today was very nice. But we are seeing a reduction since 2010. Just to give an example, in Nigeria, we used to have malaria prevalence of 40% in 2010, but now Nigeria has 22% in 2021, according to Nigeria Malaria Indicator Survey. 2022 continued to be a huge burden for Nigeria, which contributes 27% of all malaria burden in the world, and 21% of all deaths of malaria worldwide come from Nigeria. But we saw already a progress, and I'm going to talk in a few minutes about the contribution of USAID about this program. Okay. And this progress is not only Nigeria. We've been seeing a reduction of malaria across Africa. Unfortunately, since 2019, we saw kind of a plateau. Some people and ourselves believe probably is due to cause of COVID.
Okay. Yeah. All right. So we'll come back more to that. Pharmacist, what's your take on the state of malaria management in Africa?
Thank you for that question. Malaria is a public health problem, and especially in Africa. I think it's more a disease of the Africans. And it's ranked number 3 in terms of death worldwide. Yes, and we have over 2 million, and that is globally.
Yeah.
Then in Africa, we have, especially in Nigeria, we have about 1 million, over 1 million cases. Then we have, in terms of deaths, about over 300 death per annum, which to me is a big public health problem.
I think some of the things we don't talk about often enough is the economic cost of malaria, because malaria is debilitating, it slows you down, people are not able to work. Can we talk a bit about that side of malaria? So maybe more government and people will take it more seriously if we understood the economic cost.
So the malaria is devastating in terms of economy. Africa loses 12 billion a year in terms of GDP.
Wow.
And then it reduces the development of economy 1.3% every year.
That's huge.
So this is due, of course, because of people will not go to work. People would spend a lot of money on treatment. Just for example, in Nigeria, 60% of all patients, 60% of patients seen in the hospital is due to malaria.
60?
And
wow.
30% of hospitalization, especially for children, is due to malaria. So imagine
60%, and that's a staggering percentage.
Yeah, and this is not only for Nigeria, it's really the majority of the African countries, sub-Saharan Africa. But we have a good news which we are going to announce
very soon.
Very soon.
All right, I can't wait to get to the good news part. Pharmacist Gesa, what's been your experience like all the years working in the sector, managing malaria treatments through dispensing of drugs? What's been your experience like, especially in Nigeria with such a high contribution to death rates of malaria globally?
It's actually a huge problem because you talk about the loss, which my brother doctor tried to explain. It's a big problem in the sense that most absenteeism in our offices, workplace, is as a result of malaria disease. 60% is not a joke. And when we talk about somebody not being, because when one comes down with malaria, it takes at least more than a week for the person to recover fully. Within that time, the person is not at work. So we know how much we are losing.
Yeah. Even those who are at work are not fully able to perform their tasks.
Even the employers themselves, most of the time they come down with malaria and they are not there to supervise the work effectively. That's a huge loss. Then the treatment aspect, of course, the patient has to buy drug. That is cost. Then the prevention aspect. All these things are costs.
One of the things I may like to talk about, sorry for interjecting, and
okay.
Doctor, I'll get back to you on that as well, is its treatment is better in urban areas. I'd like to talk more about treatment in rural areas where for some people 1,000 naira, 2,000 naira to buy medication it's out of it. They cannot even imagine spending that kind of money.
Luckily for me, I have experience in the community setting and experience in public setting. I must tell you, it's terrible, especially in the rural areas. Yeah. You see somebody like with this ACT combination. You know, before we used chloroquine and all that, but we discovered because of resistance, chloroquine cannot take care of malaria. You need to use ACT, which is combination therapy. So, and the cost, an effective ACT drug now, minimum, the one that can give you an effective treatment should not be less than 800. Let's say 800 to 1,000. And in the rural areas, especially with the economic meltdown, if most of them for months they've not seen 1,000. Wow. So they will come, some of them that are diagnosed and prescribed anti-malaria, but they don't buy. Even when they want to buy, they don't buy all. They will tell you, give me half.
That is terrible for malaria treatment.
All right. So they will end up not taking the complete course.
Wow, that's terrible.
Encouraging resistance. Such patient, if later on they have reason to take anti-malaria, it will not work because they did not, in the first place, they did not take the complete
first one. All right, so doctor, I know you want to talk about that, but you have, I also want you to draw from your wealth of experience because you've not just worked in Nigeria, you've worked across several African countries dealing with the issue of malaria. Let us know your experience.
Let me just say one thing, which is very important. Malaria is disease of the poor. Malaria affects, unfortunately, the rural people, the people living in rural areas. In 2005, the US President, George Bush, came up with an initiative they call Presidential Malaria Initiative. This program exists in 27 African countries. In Nigeria, this program started in 2011. And so far, the US government disbursed $800 million. To do what exactly? To buy drugs. Those drugs is free. And then the US government is supporting 11 states to buy bed net for free for those people where we support. The test, because test is key. As we all know, the major cause of malaria is fever. But fever can be due to many things. In the past, we don't need to test, but now it is required to test. So we provide free tests also for those people. And then, of course, we train people. That's for 11 states in Nigeria. You can tell me, what about the other states? The other 13 states, they have a support of Global Fund to fight HIV/AIDS, malaria, and TB. And of course, the US government is the major contributor to Global Fund. And then the remaining states actually have a support of World Bank. Actually, Nigeria took a loan of $200 million so that people can have really access to free commodities so that they can reduce this burden. So that's what my brother was trying to say, that people really cannot afford. So if you provide them something which can reduce the prevalence, then they are more likely to reduce malaria.
Okay, I'm going to ask this question. In Europe, in America, and in some parts of Asia, endemic malaria has been eradicated.
Good.
What's happening in Africa? What are we doing? What are the efforts being deployed to ensure that we achieve, since we are more affected by it here?
Yes, good question. US used to have malaria. Europe used to have malaria. They eradicated malaria. Especially they use what they call DDTs, huge insecticide spraying. In Africa, I feel optimistic. Some few countries already eliminated malaria. Morocco, Algeria, Mauritius, and then even Nigeria will eliminate malaria. It's just a question of time. There is no nice tools now available, prevention tools. There is a nice bed net with very good insecticide-treated nets. And then the good news of probably the vaccine, which is now was approved by WHO in 2021.
Yeah.
This vaccine called RTSS, unfortunately, the capacity of production of that vaccine is still very limited. Only 6 million doses per year. But there is another good news even. There is many vaccine in pipeline. One of them is the RM21, which will start in 2024, and they will have a capacity to produce 200 million vaccine per year.
That is huge.
So if in a few years, Africa are going to have a vaccine. But a vaccine is not a silver bullet. We need to continue to combine vaccine with bed net, malaria prevention, if you like what you call seasonal malaria prevention. If you are pregnant women, go to the hospital so that you can have malaria prevention. And then if you come from Europe, US, where there is no malaria, you don't have a strong immunity, then you can have prevention before you come here. So we have a lot of good news on pipeline. Myself, I'm confident that after all these years, we are more likely to see the light on the end of the tunnel.
All right, pharmacist, in that same area, I wanted to talk to you about what are your opinions there?
Is it about the prevention?
Yes, about malaria prevention.
Okay. Actually, if you look at prevention, it's capital intensive. And I must tell you, government should not leave this only to NGOs. Government has to own the programs. That is the only way it will be effective.
Now, you just mentioned something which was one of my questions I was going to ask. Malaria is hugely an African problem. There are other places, but it is more an African problem than anything else.
Yes.
Why don't we see the AU and African countries spearheading this process, spending billions every year to ensure that, vaccines are developed, treatments, eradication? Why don't we see that coordinated effort at the AU level or even at the sub-regional levels?
Actually, in African Union, in fairness to them, I think they came together and formed an alliance of head of states, which were doing well in terms of funding and all that. And the chances of coming out with a vaccine. But along the line, the COVID issue in 2020 affected it. If not, we were doing well. And maybe by now the vaccine could have been out, owned by our Africans. But statistics are showing that there has been improvement. 2020 and 2021, the data are showing that the rate of death and infection dropped.
Okay,
Yes.
that's a good thing, Doctor. You talked about the drop of infection
Let me talk a little bit about Africa, about the African Union.
That is African Union.
Yeah. Yes, there is what you call ALMA, it's the Alliance of African Leaders Malaria Alliance. So it's the coalition of all the president of state and the government. They come together and they created what you call ALMA. So that the objective of ALMA is what? Is exactly to advocate, to make sure that malaria is on the agenda of politicians, to make sure there is enough money for malaria, and then to make sure there is an accountability for the money which are invested in malaria can be used for malaria. And then they create what we call scorecard. So they have key indicators where they can follow. You say you are going to do a Bennett campaign. Did you do that? You are going to procure drugs. Did you procure that? You are going to procure vaccine when the vaccine would be available. So they track and they can see that the money which was allocated to malaria is already spent for malaria. So Africa is doing very well. Myself, I believe that like here in Nigeria, actually there is what we call they created a fund which helped to advocate. They call, I'll remember the name in a few minutes, but is headed by Chair Umbalo. I don't know if, and then Dangote also is part of that alliance.
Okay, yeah. All right, we don't have much time, so I'm just going to ask something you mentioned, which was very key, is the issue of resistant strains of malaria.
Yeah.
What can we do? Because this is a major issue, because if we come up with new treatments and people are resistant to them, then we go back all over again. What can we do to reduce this from happening, and how can we engage to ensure that we have less and less resistant strains of malaria? Pharmacists?
Number one, apart from the prevention, then we should government should come up with free malaria treatment programs.
Interesting.
So that once
is
it's
confirmed,
diagnosed
yeah.
and drug prescribed, the patient should be able to get it free.
Okay.
And apart from that, even if it is not totally free, the National Health Insurance Scheme should be effective, very effective.
To cover it even
to
at the rural areas.
Thank
even.
you.
Thank
Just
you
that
very
my
much.
problem is the rural areas where this thing is you know,
Prevalent,
my
yes.
brother says it's disease of the poor, and
Yeah.
they are found mostly in the rural areas.
So we need to
The
engage
National
more.
Health Insurance Scheme does not really cover them very well. It covers people who are in town and they are working that can afford drugs. What about those that are in the rural area that cannot afford drugs?
Interesting. So, because of time, sorry, doctor.
The resistance.
Yes.
So the good way to prevent resistance is to make first, if you have fever, test yourself.
Yeah.
If it's positive, treat the true malaria drug and take all the 3 days complete. And then, of course, there is a research which monitor the resistance of those drugs. So we need to have a program at the national level which monitor the drugs used at the national level. So you can monitor the resistance. This is one of the program actually which is funded by the President's Malaria Initiative in the US, in America here, in Abuja. So we do that. We follow the resistance of all drugs used by National Malaria Control Program in Nigeria.
Fantastic.
And
so
also they should improve on drug distribution channels.
Drug distribution channels.
Where the people who are involved in importation of drug and the distribution are professionals, qualified pharmacists.
All right. We are practically out of time. So pharmacists, we'll start with you. You talk to governments, public health workers and ministers of health across Africa. What do you think they can do to improve improve on the already improving statistics that we have?
Just as I said earlier on, the program should be taken seriously in terms of funding and all that.
All right.
Then,
so you could just look straight to them and talk to them directly.
Then funding, I say.
Okay.
Then awareness to our people. And if possible, we should improve on our healthcare institutions so that the professional will not mind going into the rural areas to practice.
Fantastic.
So that the rural people can get the best.
All right. Thank you very much. Dr. Jules, your last words to governments, ministers of health and health practitioners.
So April 25th is World Malaria Day. Okay. It's a day where we advocate, the world advocate for our government continue to contribute to malaria so that we can eliminate this disease which have been lasting for long. Everybody should play his part. Of course, there is a global fund, the US President Malaria Initiative, there is the World Bank, but we still continue to advocate that each government contribute to the health system, especially putting what we call 15% of all the budget should be allocated to the health, so that people can continue to buy the effective drugs, effective bed net, being tested, etc.
Thank you very much. My guests have been Dr. Jules. It's been a pleasure having you on in.
Nice
Pharmacy Gisa, it's a pleasure. Thank you very much for joining us on Lens on Africa. Eradication of malaria is possible and we all need to play our parts. Some of us, all we need to do is take your medication and take it completely so we don't keep having resistant malaria. We're going to break now, and when we come back, Lens on Africa will continue.